I'm Konstantinos Tsoukas. I'm a PhD student at the University of West Attica in Greece, in particular in Department of Public and Community Health. And thank you for accepting my abstract and giving me the opportunity to present my research, which is a study, a part of my PhD dissertation. So the theme concerns the co-production approach in health promotion, the perceptions among mental health service users in Greece. People with severe mental disorders have impaired health, low quality of life, and low self-care skills, while presenting a higher risk of developing infections and other chronic diseases, such as metabolic and cardiovascular diseases or cancer, and higher mortality compared to the healthy population. It is indicated that people diagnosed with a mental disorder have more than 10 years reduced life expectancy compared to the healthy population. The increased morbidity and mortality of people with severe mental disorders are directly linked to the lifestyle and health behaviors of this population group, with smoking, substance use, poor diet, lack of exercise, unsafe sex practices, and other high-risk behaviors. Furthermore, people diagnosed with severe mental disorders have low health literacy, insufficient knowledge about health issues. This is an additional barrier to maintain and improving their health and quality of life, while reinforcing the need to design and implement holistic health promotion and health education intervention in this population group. We know from the literature that several health promotion programs for people with severe mental disorders are identified. For example, on oral hygiene, nutrition, and obesity, as well as sexual health. But the majority of health promotion intervention designed based on the subjective assessments of mental health professionals. The majority of interventions are based on physical symptoms, observed physical symptoms, without taking into account the possible needs of individuals. On the contrary, individuals have a need to be more participative in activities that promote their health. An approach that ensures a participatory aspect is that of co-production. Co-production is defined as the provision of services in an equal and reciprocal relationship among health professionals, service users, families, and the wider community. The process of co-production does not only refer to the provision, but includes all stages from the design and production to the evaluation and continuous improvement of services. So, a quality study was conducted in the first semester of 2023 in mental health community settings in Attica, Greece, to examine and assess the health promotion needs among people with severe mental disorders, mental health service users, from mental health community settings. Secondly, it was aimed to explore the perceptions of the concept of co-production of people with mental disorders. The research questions were: what are the needs of health promotion among people with severe mental disorders? And secondly, how do people with severe mental disorders perceive co-production in health promotion? So, about methods, the target population, the sample of the study, consists of adults diagnosed with severe mental disorders who receive services from community mental health settings in Attica, Greece. The study excluded those individuals who did not have the right to make decisions and were under legal guardianship. That was the only exclusion criteria. And the participants were recruited using a convenience sampling method. Mental health professionals of the settings who cooperate for the needs of the current research after being briefed by the researchers, informed orally people receiving service about the content, objectives, and procedures of the study during face-to-face meetings. The information was also provided in written by a leaflet, by a brochure. So about the data collection, 2 focus groups were conducted with 8 to 10 participants. Through focus groups, perceptions and opinions about the subject under study are considered, and understanding of individual issues is gained from the perspective of the participants themselves. Each focus group lasted approximately 2 hours. Initially, socio-demographic information was collected, such as gender, age, residence, status, length of experience since receiving mental health service, etc. And a semi-structured interview guide with open-ended questions was prepared by the interdisciplinary research team, whose members will have research and clinical experience. The guide, its content was divided into 3 topic sections of questions. The first section included questions about health promotion and the needs that such a program will address. The second part of the guide, there were questions concerning the co-production concept, like what do you think co-production is? If you have a relevant example, experience, or good practice in mind. And finally, combination questions regarding the participants' perceptions about the health promotion program based on co-production approach, such as like, how do you think a health promotion program with a co-production approach should be? How do you perceive your own role in such a program? And the content of the focus groups interviews was recorded using a digital voice recorder and was transcribed verbatim. No additional data were found after the second focus group when saturation was reached. Saturation was achieved as no additional data were found after the second focus group. The data was analyzed using coded analysis manually without the use of any software. It was conducted by 2 members of the research team who have experience in quality research. The most widely used thematic analysis approach described in the qualitative research methodology literature of Brown and Clark was applied. So the transcripts were read several times to ensure familiarity. And the data, initial codes were generated, things were searched and reviewed, and finally identified and named. The 2 researchers independently coded the transcripts to verify the consistency of the framework. Concerning the ethical considerations, an approval to conduct the study was obtained from the Research Ethics Committee of the university. Another approval was obtained from the settings where the research took place. Potential participants were asked to voluntarily participate in the study by signing a consent form after being fully informed about the purpose and nature of the study, as well as, of course, the right to withdraw without having to apologize for their decision. All potential participants were individuals who were not under legal guardianship, as I mentioned previously, and their capacity to consent was confirmed by the mental health professionals who provide service to them. And in addition, they had a recent psychiatric assessment. While transcribing the discussions from the focus groups, any identifying personal information, of course, was removed to ensure participants' anonymity, and all the data assessed only by the researchers. And here we have some demographic characteristics. The total number of the participants was 18. The average age was 52 years old. Most participants live in their residence with a close relative, like parents or siblings. And all participants had more than 10 years of service receiving experience. And here's a table with the emerged themes per topic, five major themes were emerged concerning health promotion needs, psychoeducation, settings and services, rights, community education, physical health, and also five major themes regarding co-production, perception, equality, collaboration, feedback, inclusion, and peer support. And let's see them in detail. Participants about psychoeducation express their needs, including counseling, medication, self-care, mental health promotion. For example, they said, I can think of a program that informs me about my illness and the symptoms I'm dealing with. What steps can I take to have better mental health beyond the symptoms? Regarding rights, participants included their rights as a part of their health promotion needs, and they focused on health care and employment. In particular, they express the need to be informed about their rights when they need hospitalization or when they are admitted to the hospital involuntarily. And for employment, the participants were interested in getting to know their rights in the workplace, how they should be treated by employers, and what kind of benefits they are entitled to when they work. Despite the majority of participants had more than 10 years of receiving services, as I mentioned before, they refer to settings and services as part of health promotion, focusing on access to and information about them. Specifically, they mention the need to be informed about the available services that someone can receive care and support. Community education is another important issue emerging in relation to health promotion needs, mainly linked to community intervention schools and destigmatization. Stigma sometimes concerns the individual, the personal stigma, as we have defined, and sometimes society. During the discussion in the focus groups, there was a strong reference by the participants to the role of schools, either in terms of education for recognizing mental health problems and seeking help, or in terms of understanding mental disorders and attitudes towards people who face deal with some kind of mental disorder. The individuals are also concerned with their physical health, maintaining and improving, do not limit their health promotion needs to manage their mental disorder. They measure the needs for information about preventive health checks. Most of them were chronic smokers and expressed the need to be educated, supported by health promotion program to help them quit smoking effectively. Nutrition was another important area. So regarding our production, quality includes acceptance, responsibility, consistency, and honesty as sub-themes. The participants refer quite often to acceptance, identifying with quality in their relationships, both with other people or with mental health professionals, with whom they emphasize that they should have an honest and consistent relationship. Most participants perceive co-production as collaboration between the individuals and mental health professionals, with frequent references to communication, co-creation, coordination, co-design, if they mention. They imagine these corporations various levels of organization of services, group intervention, like to coordinate a group, a workshop, etc. Inclusion is an also important dimension, and they attach great importance to the inclusion of initiatives as well as the expertise they bring. Peer support is another dimension frequently mentioned by participants, focusing on encouragement, empowerment, advice among mental health service users. They believe that support can encourage and motivate them on practical issues of everyday life through practical examples like financial problems. Feedback is highlighted as part of co-production process. The individuals should have the opportunity to evaluate the service they receive so that it is understood that what really benefits them. And this was mentioned and agreed by most of the participants as a necessary procedure that all settings providing services should follow, should establish. Here you can see some limitations. Set regulation was not done. Study participants received services successfully from community settings in Attica, which is a purely urban area of the capital of Greece. More studies need to be conducted on a nationwide to representatively consider the needs of people who live and receive services in rural areas, representative of the entire country. And conclude, the findings of this study could be used. First of all, to design and implement health promotion intervention programs for mental health service users, and then to develop programs and benefit services in general. They could also be considered to develop programs adopting a participatory approach such as co-production involving individuals in planning, implementation, and evaluation processes in all stages, as we know from the literature concerning the definition of co-production.